Before we get started, don't forget to hit that subscribe button for more nursing tips, assignment prep, and exam guidance. Are you preparing for your OSCE exam and feeling nervous? Don't worry, you're not alone. Today we'll break down what OSCE is, how it works, share some top preparation tips, and even show you a quick role play of a medication station using Ramipril. What is OSCE? OSCE stands for Objective Structured Clinical Examination. It's designed to assess your clinical competence in a practical, real-life setting. You'll rotate through different stations, each focusing on a specific skill, like patient communication, medication administration, or assessment techniques. At each station, you'll be given a scenario and a set amount of time. Each university has a different approach. In my university, they provided a list of medications, and I chose Ramipril. The assessment usually lasts 5 to 10 minutes and requires around 1,000 words to complete. Examiners will observe and grade you based on accuracy, safety, and communication skills. Here are my top tips for success. Understand the criteria. You'll be scored on things like introducing yourself, gaining consent, explaining the medication, discussing risks and benefits, and providing safety advice. Follow a structured approach. This helps you stay calm and ensure you cover all points. A good structure is 1. Introduction and consent. By name and position and verbal consent is adequate. 2. Check understanding. Does the patient know why they are taking this medicine? 3. Explain medicine, action, dose, benefits, risks, biological, psychological, and sociological aspects. 4. Discuss safety concerns and health promotion. 5. Provide additional resources. 6. Close with a safety net. Know your drugs. For each medicine, be confident about its name, purpose, dose, how it works, possible side effects, and any monitoring needed. Practice communication. Speak clearly, avoid jargon, and check the patient's understanding throughout. Stay calm and professional. If you forget something, take a deep breath and continue. Okay, let's start with an example. Introduction and consent. Hi, my name is Neela, and I'm one of the student nurses on the ward today. Is it okay if I talk to you about a new medicine the doctor has prescribed for you? Wait for assessor to respond. Thank you. Let me explain this medication to you. Explanation of Ramipril, biological aspects. Ramipril is an ACE inhibitor, which means it helps relax your blood vessels, making it easier for your heart to pump blood. This lowers your blood pressure and reduces strain on your heart. It's helpful not just for high blood pressure, but also for protecting your kidneys, especially since you have diabetes. It also reduces the risk of heart attacks and strokes in the future. Once you take Ramipril, it's absorbed in your stomach and then processed in your liver, where it changes into its active form called ramiprilate. This active form blocks a hormone called angiotensin II, which normally tightens your blood vessels. By blocking this hormone, Ramipril keeps your blood vessels relaxed, lowering your blood pressure. Dosing and monitoring. We usually start you on a low dose and increase it gradually depending on how your body responds. After starting, your GP will review you every 3 to 6 months to check your kidney function and potassium levels with blood tests. Psychological aspects. I understand that starting a new medication can feel overwhelming, but please don't worry. Taking Ramipril means you're taking steps to protect your organs. Many people feel reassured and less stressed once their blood pressure is under control. There's no strong evidence that Ramipril causes mental health side effects, so it's unlikely to affect your mood. Sociological and lifestyle aspects. You might need to make some small changes in your daily life. Ramipril works better if you follow a low-salt diet, so try to be mindful during family meals or when eating out. It may also raise potassium levels, so it's best to avoid foods high in potassium like bananas and spinach. Safety concerns and risks benefits. Like most medicines, Ramipril can cause some side effects. The most common ones are a dry cough and dizziness. These are usually harmless but can be uncomfortable. The cough can sometimes affect your breathing, and dizziness might affect daily activities like driving. If dizziness is a problem, you could take Ramipril at night. One important safety tip is the sick day rule. If you have vomiting, diarrhea, or can't drink enough fluids, stop taking Ramipril temporarily to avoid kidney damage and let your doctor know. Also, avoid ibuprofen, as it can interact with Ramipril and harm your kidneys. If you need pain relief, paracetamol is safer. Finally, if you're planning to become pregnant, please tell us in advance. Ramipril is not safe during pregnancy and would need to be stopped. Supplementary material and safety net. If you'd like, I can give you a leaflet about Ramipril, or you can visit the NHS website for more information. If you notice swelling of your face, lips, or tongue, or any other worrying symptoms, seek medical help immediately. I hope I've covered all the important points. Do you have any questions? And that's how you can cover a medication discussion in your OSCE. Notice how made introduction, gained consent, explained the medicine, covered biological, psychological, and sociological aspects, discussed risks and safety, offered health promotion, and closed with a safety net. This is a great structure to follow for your own OSCE. If you have any questions, drop them in the comments below. Good luck with your exams and see you soon for the next topic. Bye for now.